I'm Dr. Dhruv Thakkar, consultant psychiatrist from Ahmedabad. It's my pleasure to be a part of this educational program by Sleep Medicine Institute. As a psychiatrist, I frequently see how sleep and mental health are deeply interconnected, whether it is insomnia in depression, or anxiety related sleep fragmentation, or substance use related sleep architecture disruptions, or bipolar mood disorder related circadian rhythm changes, and so on. Yet, this bidirectional link is often under addressed in our clinical practice. So, in these sessions, we will see how mental health disorders affect sleep physiology, and conversely, how disordered sleep can affect mood regulation, cognition, memory, treatment outcomes, and so on. We will also see some precise, practical, evidence based approaches for sleep focused interviewing or structured assessment methods. Also, when to integrate pharmacotherapy and behavioral therapies like CBTI or sleep hygiene techniques, etc., for people with mental health disorders in sleep context. So, our goal is to help clinicians develop a precise framework that can help you to help patients with mental health disorders in sleep context. So thank you. And we hope that these sessions will be helpful to you in your clinical practice.